I learned that, when we learn about these hereditary diseases like hereditary cancer caused by BRCA1, BRCA2 mutations, or Lynch syndrome, or any of these other hereditary diseases, the reason why we're doing this diagnostic testing is because if somebody can find out about their genetic diagnosis before they get cancer or before they get heart disease, then oftentimes there's something they can do to prevent that. So if somebody has a BRCA1 mutation, for example, then they can get increased mammograms and breast MRIs, or they can get a mastectomy, or they can get their ovaries out when they're done having kids, and that can sometimes prevent disease. In the case of Lynch syndrome, if a woman can have over 50% risk of endometrial cancer, done having kids, gets her uterus out, that decreases her chance of uterine cancer from 60% to zero. So then I started shifting my research interests into saying, well, how come we can't get more of the relatives tested after we diagnose somebody with hereditary cancer? They've already had cancer. They're going to get the most aggressive screening because they've already had cancer. But what about their kids, their siblings, their parents, their aunts, their uncles, their cousins? What about them? Why aren't they getting genetic testing? And can we get more of them in the door? And can we help them get their diagnosis before they get cancer so they can prevent that?